color filling is not so good. So it's very difficult to differentiate where there a thrombus or not. So how to overcome that problem?
Right, good question. Yes, for the deeper ones, like the subclavian or even the innominate, it is harder because we cannot compress them. Some of the things to keep in mind is that even if you cannot get the feeling of the color of the lumen, I would rely on the spectral Doppler. So if you get a waveform with a respiratory variation, then at least you can say that there is vacancy. I know that you wouldn't be able to say that there might be a potential partially occlusive thrombus because if you cannot get the feeling of the color. But sometimes that's just a limitation of the study, right? Of course, I'm sure you know that you play with the settings in terms of lowering the scale, increasing the color gain, trying even power Doppler, or even, if possible, some machines it is possible to lower the frequency on color. So again, you get to see that, but many times that has happened to me, especially in larger patients for the subclavian vein, or patients in the ICU, for example. And again, we just have to rely on the waveform more than just the color. And of course, like I said, there may be a partially occlusive thrombus that we're not going to be able to rule out. But at least we can say that there is vacancy.
That means this has to be mentioned in our report.
I would say so, yes. If you're having a hard time getting the feeling of the color, you would have to mention it. And it could be a technical issue, right? Like I said, if it's very deep or a larger patient, I think just to be safe, you will be able to, I think it's a good idea for you to say that it was difficult, but at least you can say, for example, there is respiratory variation and flow is going.
Good. Any other questions? किसी के पास और questions हैं? जी. I'm just walking over to this Dr. Wasim here.
Yeah, sure.
Yeah. All right.
Good evening. I'm Dr. Wasim over here. Good evening. I'm also running an institute here from last 25 years. And but unfortunately, I'm not doing color Doppler as yet. Inshallah, I will start soon. The thing is that you have not mentioned anything regarding the frequency of the probe. What should be the frequency you would like to use in this case?
Sure. So the frequency for the vascular probe, the linear probe, ranges between 5 and 7 or so. Obviously, from make to make, there may be some variations, but you want it in that range so that you can access the deeper veins and at the same time be able to detect the waveforms. In addition to your question, something else that I want to mention to the previous question, and thank you for asking this question about the probe. There's been times that for deeper vessels, if it's not possible to see it with the regular vascular linear probe, you can use the curvilinear probe, the abdominal probe. And so you switch to that. And of course, the range there goes from 2 to 5 or so. So you are able to see deeply. You can see those vessels that you're having a difficult time with. And then it might be easier actually to also get to fill in the vein with color. And of course, the spectral Doppler will be much easier. So that's something else I forgot to mention for the previous question. So you can switch to the curvilinear probe. And some people, I haven't done it myself, but some people actually have used the transvaginal probe on the upper extremity veins. If, for example, they have a hard time to look between the ribs, or even the numbness. You know how here it's such a small window that we have, and if you don't have a pediatric probe, those tiny probes, you can actually use an intravaginal or transvaginal probe. It will be a little awkward because it's a longer probe and you're placing it here, so you may have to hold it with 2 hands, for example, or hold it very close to the skin. But again, that gives you a wider field of view and much deeper penetration. Hope that makes sense.
That's great, Leo. You know, the thing is that in Pakistan we have an issue of having too many probes. We're not, you know, the machines usually have a linear and a curvy linear and a trans-patch probe. So the linear probe is usually the, you know, the L12 one, the one that we use for the thyroid and the superficial. So, so the second step would be for them, I think, to use the curvy linear. Or and one more small point I would like to make that, you know, remember the time in Toronto we used to, you know, still of course they are doing it, but I'm not. You know, with the disinfecting the trans-patch probe with Sidex, this is something that is not being done in Pakistan. So, you know, I would be a little concerned about, you know, using you know, a probe that is not being disinfected per se, you know, on skin. But of course, when need is, I guess, you know, they have. That's a great idea. Yeah, that you know, the doctors are really appreciating. I'm going to walk over to another doctor, right? Yes. Yeah. Okay. Yeah.
On that note too, there's been cases that I have worked in some clinics where they only have